As you learned in the BK coding video, with proper coding, RevoFit can increase your bottom line and add to the profitability of each socket you deliver. However, as we all know, insurance reimbursement is a tricky business. Fortunately, there are a few strategies we've learned that lead to success when coding. In this video, we will teach you the most successful AK billing strategies, the best codes we've found, and provide you with the documentation you need to maximize your profits. Keep in mind that the strategies presented in this video are ones that many practitioners have successfully used for reimbursement. That said, choosing proper codes is ultimately up to the practitioner and must be properly supported and documented with medically necessary patient indications. So, let's figure out how to get you paid. The first thing to understand is that RevoFit is a component of the overall socket, and that adjustability, in and of itself, does not come with a code. But the overall construction elements of the socket will qualify for various codes, as well as various standard add-on codes. We know that practitioners practice their craft in various ways, and that every patient is unique. Therefore, for coding an AK socket, we have identified two paths that make the most sense. Path 1 is used if you do not use a flexible insert in the check socket phase. Path 2 is used if you want to use a flexible insert in the check socket phase, or if you intend on making a preparatory socket. In this scenario, it's helpful to fabricate the flexible insert during the check phase. We will take you through the process and identify the appropriate codes you can use for both paths. Path 1 follows the process you just learned in the Can You Adjust check socket video. 1. Fabricate and fit the check socket to verify fit and volume. Use code L5624. 2. Once fit is verified, add the RevoFit hardware to the check socket, verifying panel placement and testing the functionality. For this step, use a second L5624 code. 3. Make a positive model of the check socket, and then pull the flexible insert and fabricate the definitive adjustable socket. Use codes L5321, L5651, and the optional L5999 code. Four, fit to the patient, tune, and instruct on usage. Then bill to insurance. With this strategy, you will have the opportunity to bill for $9,829 plus any additional add-on codes you normally use. To ensure billing success, use the supporting MSRP and LMN documentation we provide on our website. Path 2 follows the same basic principles, but it incorporates the flexible insert in the check phase. One, fabricate and fit the first check socket to verify fit and volume. Use codes L5624. 2. Create a positive model from the check socket number 1, and then pull the flexible insert over the mold. Then pull check socket number 2 over the flexible insert. Use code L5651 and a second L5624 code. 3. Add the RevoFit hardware to the second check socket. 4. Fit the socket to the patient, verifying panel size and placement while testing the overall socket functionality. If your socket design works well, path 2A, then build the definitive socket using the check socket as your guide. Be sure to use the flexible insert you made earlier for the definitive. Use code L5321, the optional L5999 code, plus any add-on codes that you normally use. If you need or want to test the socket over time outside of the office, path 2B, then significantly reinforce the check socket base with fiberglass. Attach the necessary hardware and deliver it as a preparatory socket. Use code L5580 and the optional L5999 code. If the preparatory socket comes back working well, then build the laminated definitive socket and bill L5321, the optional L5999 code, plus any add-on codes. 5. Once your definitive socket is fabricated, fit to your patient, tune the fit, and bill to insurance. For Path 2A, going straight to the definitive, you will have the opportunity to bill for $9,829, plus any add-on codes you normally use. For Path 2B, using the prep socket, you will have the opportunity to first bill $8,789. Later, when you build the definitive socket, you will use code L5321, the optional L5999 code, plus any add-on codes you normally use. Total reimbursement will depend on how this process unfolds. To support your billing efforts, we provide on our website ready-to-use documentation to ease the process of submitting for reimbursement of adjustable sockets. Specifically, we have included our MSRP language, justification for components language, and a pre-drafted letter of medical necessity. We also have a handy calculator to help you understand your costs versus the reimbursement you can submit for. Utilizing these resources helps you confidently submit for reimbursement, and you will realize pretty quickly that these steps are well worth the effort. So, what's the bottom line? Using our coding strategies, the provided language and justification, and our MSRP, you can bill for reimbursement when creating adjustable sockets. Combine this with the fact that you will reduce socket remakes and refitting events, all while creating happier patients with better outcomes. The case for adjustability is crystal clear. It's better for you, your patients, and your bottom line. Can you adjust? We know you can.